this session on the world shouldn't wait any longer for universal hand hygiene. And so on behalf of the Global Hand Washing Partnership, on behalf of UNICEF, WaterAid, and WHO, welcome. I wanted to let everyone know that we can ease ourselves into this session because it is early for many of us, and I'm sure there are still participants that are trying to figure out how to come in, but I think we'll just advance. So my name is Bruce Gordon. I'm the unit head of WASH at the World Health Organization. I wanted to let everyone know that there is interpretation in French. So just for the French participants, aux participants francophones, veuillez suivre les instructions sur l'écran pour télécharger une app. So it's a little bit complicated, but you have to find an application and it's all written down and the instructions are there to do that. So I'm going to be turning my attention, or our attention, to the context of this session, and so I'll be we're going to be hearing from Heather Moran, my colleague from UNICEF, who is going to talk a little bit about the context. But obviously for us there is a lot of concern, deep concern. But we feel there's wonderful opportunities and new learnings and a lot of momentum to accelerate hand hygiene. So very briefly, you're going to be hearing a few presentations, and then we're going to, I think, in a really exciting manner, to go through some country case studies from Pakistan and Nigeria, and then we're going to have a little discussion afterwards to kind of consolidate some of the learnings. So with that, I'd like to hand it over to my colleague, Heather, to take us through the initial presentation.
Great, thanks very much, Bruce, and good morning to all of fellow hygiene out there. My name is Heather Moran. I'm a WASH specialist with UNICEF headquarters, and I lead UNICEF's global hand hygiene initiatives. So today I'm going to be proposing a definition for what we mean when we commit to reaching universal hand hygiene status. Not just talking about the coverage of hand hygiene facilities or the actual hand hygiene practice, but also the enabling environment that's critical for the sustained achievement of universal hand hygiene. So next, thank you. The most obvious component of a definition for universal hand hygiene is 100% coverage of hand hygiene facilities across those key settings, a proxy indicator for actual practice. And I'm assuming, considering your participation today with the conference, I assume that you're familiar with the JMP's work. So for households, schools, and healthcare facilities, the JMP already provides clear definitions and core indicators recommended to monitor hand hygiene progress towards those 2030 SDG hygiene targets. And the guidance documents that you can see at the bottom of the slide provide detailed definitions of these indicators, with each indicator being supported by a set of recommended questions for use in data collection. So that will allow the classification of the facilities in relation to the JMP's hygiene service ladders. So at the beginning of the COVID pandemic, the JMP published a synthesis of available data on hand hygiene. And we can now use this as a pre-pandemic baseline against which we can be tracking progress toward universal hand hygiene across these three settings at the country level. But it leaves gaps around the definitions and indicators for tracking coverage of the facilities and other critical settings, like your public spaces, like markets and car parks, workplaces, prisons, places of worship. And these are settings that need to also be covered to achieve universal hand hygiene. Next, great. But in addition to measuring achievement of universal hand hygiene by the coverage of facilities across settings, we believe that there are core systems that have to be in place to enable sustainable achievement of both facility coverage as well as practice. And the first of these areas is good governance, including the leadership, the effective coordination, regulation, and clear policies on hand hygiene services and behaviors across all settings. Second is adequate financing, fundamental to achieving and sustaining the step change that we need on hand hygiene. And we know that improved targeting, better utilization of existing resources, and mobilization of additional domestic and international funding is going to lead to more efficient service delivery and implementation. Third, to have sustained universal hand hygiene, this requires having also consistent data and information to inform the decision making and for strategic investments. Right now, currently, the JMP Global Database on WASH in schools can only produce hand hygiene estimates representing 57% of the global school-age population. And estimates for basic hygiene services and healthcare facilities are even lower, only representing 26% of the population. So strengthening data and information systems is going to help countries fill in those data gaps and provide a better picture of the progress that we've made and what's needed to achieve that universal hand hygiene status. Fourth, capacity development ensures that a country has the right people and the right skills to actualize hand hygiene plans and strategies. And of course, that capacity has to be considered across all the different settings, their relevant ministries and stakeholders from the national level to the local level. And then finally, systems to enable the hand hygiene innovations around infrastructure, social and behavior change, and service delivery are going to be critical to accelerate the progress that we're making, as well as to sustain the achievements. So for looking at a comprehensive definition for universal hand hygiene, we need strong systems across the 5 pillars of the enabling environment: the governance, the financing, data and information, capacity and innovation. And together with all of those, that will enable and sustain the 100% coverage of hand hygiene practice across all key settings, including the households, the institutions, public spaces, and workplaces. So today we're presenting a tool that looks at 2 aspects of universal hand hygiene. The first tool is looking at a country's progress, tracking a country's progress, and establishing those policies, services, and systems for hand hygiene. And the second tool examines the quality of a country's enabling environment for the achievement of the 100% coverage of facilities and practice across critical settings. So thank you very much. And I'm going to, I think Erin's now going to speak a little bit more about these tools. So thank you. Bruce?
Yeah, no, thank you so much, Heather, for really giving us a comprehensive sort of holistic look at what is required to really kind of get to full hand hygiene coverage. I wanted to say one thing. You mentioned the WHO UNICEF Joint Monitoring Program, and there is a session coming up next week that gives the latest figures on WASH and healthcare facilities, and the hand hygiene figures are quite shocking. So keep an eye out for that. And now I would like to turn it over, as you said, to our colleague Erin at the Global Hand Washing Partnership. Over to you, Erin.
Thanks, Bruce. Hi, everyone. My name is Erin Palomares, and I manage the Global Hand Washing Partnership, which is a public-private partnership that serves as a global advocate and knowledge hub for hand hygiene programming. And today I'll be presenting a couple of tools that have been developed to help countries track their hand hygiene progress. These tools were tested among the countries who will be joining us for today's session, and they'll provide more specific insights up next. First, just to provide a bit of a caveat, we haven't come up with an exact name for this process, but the process that has been created includes 2 distinct but complementary tools that can be filled out jointly by relevant stakeholders, and ideally under government leadership. These tools include the Hand Hygiene Progress Tracker and the Hand Hygiene Enabling Environment Assessment, which I'll go over in the next couple of slides. The first tool is the Hand Hygiene Progress Tracker, which serves as a broader advocacy tool to provide the basis for motivation and momentum around hand hygiene at a country level. At a global level, it also allows for a range of organizations to see where progress has stalled and provides an indication of where ongoing support is needed, with the intention of furthering country processes in different ways. Countries involved in the Progress Tracker can provide a learning opportunity for others. The information results in an overview of the key milestones that all countries should use in their processes of achieving hand hygiene for all objectives. This tool provides a snapshot of country progress focused on processes and articulates key milestones that are included on the screen and draw on other examples. Countries can self-report on their progress under key areas and using questions provided in the tracker by using the traffic light criteria shown on the screen, indicating either no progress, progress with some constraints, and good progress or complete. While there isn't a set timeline to use this tracker, it may be helpful for countries to use this as a cyclical activity on an annual basis to understand their progress on these key implementation milestones. The second tool of this broader process is called the Hand Hygiene Enabling Environment Assessment and is meant for policy review. This tool allows a country to review the quality of their policy strengthening work and allows development partners to identify areas to target investment and tailor technical support. The aim of this tool is to assess the quality of content in national hand hygiene policies and programs. It helps to identify any weaknesses or bottlenecks to a country's progress and provides guidance on how to best prioritize actions and interventions. Similar to the Hand Hygiene Progress Tracker, the Hand Hygiene Enabling Environment Assessment asks countries to self-score using traffic light criteria to indicate either no progress, some progress, good progress, and completion across the 5 enabling environment pillars listed on the screen. Based on each pillar's score, the tool provides an illustrative result that countries can use to assess their enabling environment status, which can then help them act accordingly to unblock bottlenecks and continue progress. And with that, that ends my presentation. This was really meant to be an overview of these 2 hand hygiene progress tools in the overall process, but hopefully you can see how they are complementary to one another and how these tools might be used to track country progress. Next, we'll hear from a couple of countries who have actually gone through these tools and hear more about their experience with this process. So I'll pass it back over to you, Bruce. Thanks again.
Okay, thanks, Erin. And of course, it's hard to do justice to some of the work on these tools with that quick overview, but we really encourage everyone to have a look and a deeper dive into them. And certainly there have been advances on these since we've talked in previous years. Now, I have the pleasure to now introduce Dr. Shafiq. She is the director of WASH from the Ministry of Climate Change in Pakistan for the Pakistan case study. So over to you, Dr. Shafiq.
Hello, good morning, and assalamu alaikum to all the colleagues. This is Dr. Saima Shafiq, working with the Ministry of Climate Change as Director WASH. So today's presentation is Pakistan Roadmap Pakistan Roadmap for Hand Hygiene for All. Pakistan is the 6th largest country in the world with an estimated population of more than 215 million, and according to SDG definition, 88% of the people have access to basic or limited water services, whereas 64% are having access to basic sanitation, while 25 million are still defecating in open. As per JMP definitions, if we see that 4 out of 5 Pakistanis have access to basic hygiene. Very recently in COVID-19, a national level survey was conducted in which reflects that almost 50% of Pakistanis have access to basic hygiene services. Pakistan's key national policies like sanitation policy, drinking water policy, it lays an emphasis on hygiene. Pakistan recently launched Clean Pakistan movement in 2019 that includes access to safe sanitation, hygiene, solid waste management, and plantation. The movement actually supported us in building the necessary political will in the country, across country on hygiene. Later on, this also resulted in development of national roadmap for hand hygiene for all through a consultative process. Very recently, provinces are currently working on their costed plans for hand hygiene. Although the process is still underway, and there are the costed plans require the approval, the final approval from provincial governments as well. Meanwhile, Ministry of Climate Change has developed the National Behavior Change Communication Policy Strategy for Clean Pakistan movement, which has very clear and specific focus on creating awareness and building necessary behaviors and hygiene interventions. If we look at the status of the tracker, this is a good. This reflects a good progress on the development and rolling out the process among 5 thematic areas. The challenge is around appropriate need assessment by virtue of limited data available around some settings like hand hygiene in schools, hospitals, public places. Similarly, we have challenge of establishing a robust baseline for hand hygiene for all. In majority of the scenarios, we are at the initial stages, but there still is progress which is reflected as yellow. This section of the tracker is more subjective. We look at the enabling environment scenario. The tool is very good. It is structured and easy to follow because of the multiple choices. The diagram is useful in assessing the current situation, which reflects that which area requires what kind of actions. Though we are good in the financing section of the tracker, but scored low as the questions are more structured. More questions need to be added for the capacity development and innovation, as only 2 questions are not sufficient. Or even at times becomes misleading. The number of key bottlenecks around 5 thematic areas are also identified as for each thematic area is alluded in the presentation, like private sector. If you see as an example that private sector involved in development of plans, but its targets are not yet set. This slide reflects that the above actions and links like developing technical guidance for government and private sector for all settings should be established, and seek the integration of costed plans in government of Pakistan, budgetary allocation. Similarly, training curriculums and human resource development tools require additional support for revision and alignment with SDGs and total guidelines and the global guidelines. Utilize the existing outreach and utilize the existing outreach of the private sector. Thank you very much. Hello, good morning.
Thanks very much, Dr. Safiq. I hope everyone is able to keep up a little bit, and we're going to have the opportunity to dive in and really kind of explore some of these details. It's a very rich presentation, and obviously so many dimensions were raised. So thank you very much. And now what I'd like to do is quickly transition to Nigeria. And we have with us Ayaba Kogbara. She is she's with the Federal Ministry of Water Resources, Assistant Director for Hygiene Services, and she's going to be telling us about the Nigeria case study. So over to you.
Hello, everyone. I am Ayaba Kogbara, Desk Officer Hygiene, Federal Ministry of Water Resources, presenting the Hand Hygiene for All Roadmap case study for Nigeria. A brief overview of Hand Hygiene for All for Nigeria. According to the Water, Sanitation and Hygiene Routine Outcome Mapping carried out in Nigeria in 2021, households have access, 17% of households have access to basic hygiene services, 11% in schools, 6% in healthcare facilities, and 4% in market and motor parks. With regards to motor parks, with regards to enabling environment, we have made some progress in Nigeria. A national hygiene promotion strategy was developed in 2016. In this strategy, hand hygiene is prioritized in households, schools, healthcare facilities, media, and through mass media channels. We have also developed a hand hygiene roadmap for all, which is in its final stage and will soon be launched in the next 2 weeks. A market assessment of hygiene products and services was also carried out to enrich the roadmap. This slide is a graphic of the tracker performance of the hand hygiene enabling environment assessment tracker tool that was carried out 2 weeks ago. The green portion shows how well we are doing. Yellow shows that we are progressing, and green shows that still no work has been done at all in this area. And based on the tracker tool, this is Nigeria's enabling environment status. There's urgent need for national policy on wash with dedicated section to hand hygiene. We also need to review the hand hygiene for all roadmap budget to specify items that identified under finance in the assessment tool. There's also need to facilitate access of all government departments to the existing monitoring and reporting system, that is our washings, and to carry out a needs analysis to address capacity gap. And finally, we need to develop innovations to address the vulnerable. So what are the key bottlenecks that need to be addressed from the assessment tool? On governance, we saw an absence of a harmonized wash policy with dedicated section to hand washing. That needs to happen. There's weak coordination among sectors and across all levels of government, resulting in fragmented approaches. And there's standardization, no standardization of products, services, and approaches. We need to work on this to ensure that we achieve our aims in hand hygiene. On innovation, there's focus on facilities rather than behavioral change. We need to ensure that that changes too. On finances, there's absence of dedicated budget for hand hygiene and operations, hand hygiene operations and maintenance. We need to advocate to government for this to happen. And finally, there is need to build the capacity in the sector. Monitoring and evaluation, on monitoring and evaluation and data and information, we do not have any data for that because we are yet to commence the implementation of the roadmap. Thank you very much.
Thanks so much, Yaba. And I can just say, after witnessing this, and I'm sure all our participants and colleagues seeing this will agree that you're doing really important work. There are such great challenges, in Nigeria and in the rest of the world, frankly, that we're really keen to kind of, share experiences so that we can learn together. So what I'm going to propose is that this is the part at the beginning where I mentioned that we're going to have the opportunity to have some deeper discussions. And I hope what we can do is, I know that we've kind of gone through the initial kind of part of this, kind of group or this session quickly. But what we're going to propose is that for all the participants, if you can just kind of select one room. So there's going to be a Pakistan button and a Nigeria button. And you'll get a pop-up on your screen, so it should be quite easy. And then you just press join. And what I would propose is we go ahead and we join one of the two, and then we'll have potentially, with some extra time, an opportunity to have some exchanges on questions. So if anyone has any questions on the tools or the data presented, we can maybe do a little bit of that. But really what we would like to do after is to explore some of the opportunities, challenges, and bottlenecks, and really how to address some of the barriers that we've seen in each of these countries. So I think this will be fun. and we could be a little bit flexible because we, excuse me, have a bit more time. So why don't we proceed to break out, and it's not going to be too traumatic because it's going to be two larger groups. And with that, I can offer up the buttons. So we're seeing now, yeah, some of the, I'm not sure how we're going to do this now. If the buttons will come up. It may look different on my screen, so just bear with us. Okay. So I think if anyone's having any trouble to select a button, we hopefully can be automatically assigned. So don't worry too much. And then we'll have potentially a little bit more time at the end to kind of circle back to some of the items that were raised at the beginning. So it looks like we'll be assigned in about 30 seconds. So I realize I still kind of have the floor here, and I'm not sure, Aaron or supporting folks, if we have managed to make this breakout group happen, or if this is still one large plenary. And if it is one large plenary, then we could maybe proceed with a little bit of introduction from the facilitators.
There are some people in the breakout groups.
Yeah, you just click breakout room and you can join whichever one you want at the bottom.
If you're not able to, though, please just let me know what group you'd like to join in the chat, and I can also automatically assign you.
Okay, thanks, Claire, for that guidance, because I'm seeing how to do it now. So I'm going to join Nigeria, and we'll see how that works. Okay, welcome back, everyone. And as per usual, we were right in the middle of a wonderful response from our Nigerian representative, and it got cut off. So hopefully we can explore that a bit more. But welcome back. I hope that everyone was able to find the rooms. I want to thank everyone for the exchanges, and particularly as I kind of mentioned, I think there's a lot of questions directed to our colleagues in Pakistan and Nigeria. So thank you so much for essentially having all these questions sort of thrown at you, at least in our group. And there was one other issue before we go to report back. So I understand we're missing the interpretation in French. So nous nous excusons, il y avait pas un petit problème technique pour la côté français. Donc on a seulement anglais. Désolé. I hope you can still follow us in English. So maybe right now what I'd like to do is invite the rapporteurs to report back. And so I'm pleased that we have the UNICEF and WHO sort of secretariat that can do this. And I understand, Edwin, you're available to report back on some of the discussions in Nigeria. And I also understand, Kamran, you can talk a little bit about what's happened in Pakistan. So maybe, Kamran, can I put you on the spot to take us through what happened in Pakistan and any of the lessons learned and barriers. So over to you, Kamran.
Thank you very much. And yes, we had room full, about 15 participants, and thanks to the facilitator. Our main discussion was how Pakistan came up so quickly with hand hygiene for all roadmap. So, and then there were colleagues from other countries were quite interested to know. So there was initially we spent most of our time in discussing that and asking each other how this was done. And then we, in the last 10 minutes, we did narrow down to bottlenecks. So not much to present, but I'll be brief. So the main reason which was presented by Pakistan for coming up so quickly was that in Pakistan, where there is a culture led by the government which is regularly doing joint sector reviews and using sector-wide enabling environment analysis tools like Washpad. And this tool was quite similar and with the same similar headings. So it was very easy for Pakistan, first of all, to draft and then launch the hand hygiene for all roadmap with under the leadership of Minister of Climate Change, and then use the hand hygiene for all tracking and enabling environment tools. So that was the first summary of discussion. Then looking at bottleneck, the major two bottlenecks were summarized. One were related to financing, that the roadmap is there now, how to finance it. And one of the suggestion was that we need to do advocacy and we need to generate evidence and maybe use this tool to for the advocacy purposes, that these are the weaker areas and we need to do more and get government and other stakeholders finance this roadmap. The other set of I think bottlenecks was clubbed into that the government need to lead on providing more technical guidance to all stakeholders, especially private sector, which is quite vibrant to participate and contribute, but we don't have that guidance over there, which can give them incentives as well as make the environment enabling enough to that they can help the government progress on hand hygiene. And then while we were closing, then the whole issue of why to focus on hand hygiene was coming up, that we need to look at we need to prioritize hand hygiene, but within the overall perspective of health and economic benefits in the country, and that needs that government prepares guidelines for curriculum, for inclusion in curriculum and all other stakeholders. Thank you.
Thanks so much, Kamran. And it actually is really fascinating because I think a lot of the, the themes that you raised on behalf of the group kind of align quite a bit actually with what we will hear also from Nigeria in terms of the challenges of financing, engaging private sector, et cetera. So I think what I'll propose is I'm going to invite Edwin to kind of come in here. And then if we have a couple quick minutes, we can open it up for questions just before Amaka closes. So Edwin, over to you.
All right, good morning, colleagues, once again, and thank you, Bruce, for the introduction. So during the breakout section, the questions were asked, and the presenter from Nigeria, Ayaba Gobara, also highlighted on some of the key identified barriers and bottlenecks, covering governance, innovation, finance, and capacity building. But key among the bottlenecks that have been identified from the presentation include one, low capacity development for stakeholders in the sector, and then lack of dedicated budget for hand hygiene operations and maintenance, and also the issue of absence of harmonized policy for wash with dedicated section to hand hygiene. So these are the issues that were raised, and also discussions from colleagues also pinpointed areas around the low level of hand hygiene practices despite increasing awareness and weak coordination among stakeholders. So after these barriers and bottlenecks were identified, some of the proposed actions for the area that involve dedicated budget for hand hygiene operations, suggestions, proposed actions, solutions were that there should be an advocacy to the Ministry of Finance, which coordinate all financial inflow into the country to see how they can increase funding for hand hygiene and wash related functions. There is also need to increase political will at the state level, and then the need to upgrade local government wash units into department to enable them access funds. Under the low level of hand hygiene practices, there is a suggestion or proposal to drive a behavioral change advocacy at all levels. And then there were also questions around looking at the coordination of the hand hygiene practices, and the coordination of the stakeholders, especially leveraging from the Clean Nigerian campaign policy and implementation. There are questions around how the specifics of the hand hygiene issues should be properly identified and situated into the plan so that it doesn't lose its relevance. And then around capacity building for stakeholders in the sector, suggestions were around training and retraining of stakeholders, through leveraging on integration of wash and hand hygiene education into institutional training curriculums. And then around the harmonized policy, the absence of harmonized policy, there are suggestions for need for to develop a long-term local solutions for hand hygiene, local actions at state and government level. This should be long-term and should be driven by governments at the subnational level. So over to you, Bruce. If there are some other things we can also bring to the spotlight. Thank you.
Okay, thanks so much, Edwin. And that was a wonderful summary. I think what I'd like to do right now is just quickly want to touch base with Ayaba and Dr. Safiq. Was there anything you felt that was omitted from the report backs or any other participants? Did we capture it all from your side? Maybe Ayaba, I can just ask you if you felt that there's anything you wanted to particularly add. And while you think, and there may not be anything to add, I'm going to take this opportunity to also ask if there is any questions or comments from the group. And I know it's kind of, one needs to be courageous to raise your hand in a kind of funny virtual setting like this and ask a question or make a comment, but we are going to take that chance and welcome that. But Ayaba, was there anything? Sorry, I've just seen your video go on and off. Did you want to add anything, or were you comfortable with that? You're okay. Wonderful. So any comments from the group? Any great omissions that you may have seen that were not raised, or anything you want to anyone wants to particularly emphasize? So I'm just scrolling through the all these dark screens, the joys of moderation. I'm very much looking forward to seeing people in person next week, so we can circulate amongst physical bodies and see faces and do all those lovely things we do in person. I see, Nicole, you turned on your video. I don't know if that was just out of solidarity or you have a question.
I was so alone earlier in my group. I wanted to give you some company, and maybe not an omission because it was mentioned, but really a point I think that's very, very critical, and that I heard echoed all over the South Asia region, and a lot of the collaboration that we did with East Asia and Pacific as well, is this kind of dichotomy in between separating hand hygiene out of sanitation programming or keeping it in for stronger impact. So, and I think that came up just now in our group discussion, that came up in a lot of discussions that we had on a regular basis. And I think it's so interesting to be able to discuss hand hygiene by itself, to give it the prominence that it needs, to have sessions like the one that we have right now, where we really focus on it, and when we're really able to give it the importance that it has, versus kind of hiding it a little bit under this big umbrella of sanitation programming. So just some food for thought, and maybe a little bit of provoking, hopefully, other reactions.
No, I think that's a great point, Nicole. And I also think when we think about hand hygiene for all, and we think about all these different settings where we want to, progress, and yes, there's the household, but when we think about healthcare facilities or markets or schools, I mean, there's obviously a lot of complexity on how we situate this and just the institutional arrangement. So a wonderful comment. I see, Heather, you've also turned your video on out of solidarity. So do you have anything you wanted to add before we close?
Sure, and it was actually very similar to what Nicole said. So first, I just want to say thank you to Pakistan and Nigeria colleagues for really, working with us on a very new tool, and really excited to receive the feedback on it, that it is a tool that helps them identify sort of those bottlenecks and weaknesses where we can start intervening to accelerate progress with hand hygiene. And that was sort of the comment that I wanted, is that we're very aware of the fact that there are a number of tools out there, and we didn't want to create more burden as this was being developed on the countries to complete it. And so, but we did also feel like there was a big gap. And when we were looking at the results from the other tools, the glass, the wash fin, all of those, hygiene, there wasn't a lot of data on hygiene because there are other things that perhaps were prioritized over it. And so we did feel like it is an important tool, but we also want to be looking at opportunities for integrating the tool into regular country mechanisms, so that it can be more streamlined and easier for countries to use. So definitely looking forward to having conversations around that space and looking for the best place for these tools to fit. Thanks, Bruce.
Thanks, Heather. Yeah, and I'm sure people couldn't agree with you more, in the sense that we need to drive hand hygiene forward, and in some sense it needs a little bit of its own space, but unless it's integrated, it won't be sustained. So that was, I really appreciate those two comments. I think right now what I'd like to do, I don't see anyone else, so you've had your opportunity. There's a lot of follow-up work here, and I think we all need to work together to really promote this. And so with that, obviously thanking everyone again, but I would like to now, I think we're have the opportunity now to hear from Amaka, who is a director at WaterAid, and she is going to have the task of summarizing this and closing the meeting. So over to you, and thanks so much for being with us.
Thank you so much, Bruce, and thanks to Pakistan and Nigeria for being the first to try out this, for being the experimental lamb. It's great to see where Pakistan started, which I think the tool kind of enabled them to accelerate some work that they were already doing. So they were building on something that was already there, which made it quite easy for them to apply the tools. Nigeria also did the same. There are a couple of programs, ongoing programs in Nigeria, particularly the Clean Toilet Nigeria campaign, which is also an opportunity to see how hand hygiene fits into this. There were a couple of bottlenecks that they identified in relation to the outcomes from using this tool. I think Pakistan was very clear on the need for private sector guidance. How do the private sector get involved in implementing the hand hygiene plan that any country has? Particularly, we all know that there needs to be a business case for the private sector to get involved. So in terms of they want visibility, they want return on their investment. Is there a guideline that we can either work with the various countries to help provide the private sector with that guideline that they need? There is also the issue of how do we actually use the results and the findings from these assessments and the tracker as an advocacy tool to government to really put that emphasis that there should be on hand hygiene. I mean, one of the things that came out, one of the questions was that, yes, it's yet another tool, but it is an important tool. And I think the tool can help us in many ways, both for global monitoring, reporting, and comparison across countries. Because at the moment, if you look at the GMP data, the hygiene data is very sparse and quite minimal. And using this tool, I think, can provide that data across countries that we can use to have that comparison. At the national level, it is also important that we encourage for more use of this tool because it provides the evidence for advocacy that governments can use, government ministries can use to advocate for more funding, more institutional clarity on what actually happens, provide that enabling environment that it is used. So I think going forward, Pakistan and Nigeria has, I think, proved that this tool is doable. It can be used by countries. I think the next stage is how can we encourage more countries to use it? How can we find a way of integrating it into existing monitoring frameworks so that it's not another burden for data collection by countries? What is the business case we have to make for these tools to be used? For example, that is important for evidence generation, for advocacy, for hand hygiene financing, hand hygiene clarity on institutional development. And is there another angle that we can use for this tool assessment? How is it applied at the subnational level, especially in countries where they have, like Nigeria, like Kenya, countries where states kind of make their own decisions based on a national policy. So I think these are some of the things that we need to look at going forward with this tool in pushing ahead on the way we use the tool. Once again, thank you so much to the team that is working on this tool, WHO, UNICEF, and colleagues from WaterAid and all the other colleagues that have participated in both in developing and in trialing out this tool. And I hope to see this tool being spread across, especially with in the WaterAid countries where WaterAid works, which is about 26 countries. We're going to try to see how we can push out these tools to be used because it does also respond to our new global strategy. Thank you very much, Bruce, Heather, and all the rest of the team, and Nicole. Thanks.
Okay, thanks so much, Amaka. And I think the session is now closed. A huge thanks to all of you, and particularly those folks who joined us early, obviously, but those working behind the scenes as well, like Aaron. So with that, enjoy the rest of your day. And we may or may not see you in other sessions, but look forward to discussing how we accelerate hand hygiene for all.
Thanks, everyone. Bye.
Thank you very much.
Thank you, everyone.
Thanks so much, Bruce and everyone.
Thank you.
Thank you.
Thanks, everyone. Bye.